Hello, everyone. I'm Governor John Carney. Thank you for joining us for our virtual town hall meeting tonight for COVID-19 update. Normally, early in the week, we have a press conference where we give Delawareans and the press, through the press, an update on the situation with COVID-19 here in the state of Delaware. We have special guests normally, and we do tonight as well for our town hall meeting. We'll go through our slides a little bit quicker than we normally do, but we are delighted to have with us Dr. Carol Rattay, who's normally with us as the Director of the Division of Public Health, and we always thank her and her team for their really tremendous work in responding to COVID-19. Dr. David Tam, who's new for our virtual town halls and our press conferences. Dr. Tam is the new President and CEO of BB Healthcare in the lower part of our state. He's going to be with us tonight to talk a little bit about his help, the health of his organization in getting vaccines in people's arms in the lower part of Delaware, reaching out to the community, partnering with community organizations, and doing an excellent job in providing healthcare to Delaware residents in the southern part of our state and our visitors. As we know, we have thousands of visitors who come to the beautiful Delaware beaches during the year-round, most of the time, but also in the summer. And Dr. Susan Bunting, who's the Secretary of Education, is here to talk about our efforts to assist school districts and schools and teachers and educators across our state address the instructional and educational needs of all of our students, given the situations they've been over in the last year and things they might have missed, things they need to catch up on, and additional resources so that we can help them over the summer, working with the school districts and teachers and others, and into next year with extended day programs. And she and her team have come up with a great plan for doing that. We also have Pam, our sign language expert for the deaf and hard of hearing, and she is with us each week as well. So why don't we go right to the data and the presentation, the slideshow that normally we have. There's our data update. Things are looking a little bit better. The new positive cases on a 7-day moving average are now under 300. They, for several days, were over 300 and getting concerning. We'll have a graph to show you a little bit, illustration of that as it is seen in hospitalizations. Our positive testing rate is just a little bit over 5%. The World Health Organization target is to be under 5%. We have been under 5% over the last several months, but recently we've ticked above it. So it's good to see us closing in on that milestone as well. And the number of hospitalizations are going down as well at 149. We'll show you the trajectory from last April until to the present. Lives lost has flattened out, thank God. Every life is a precious one for sure, with family and friends, but we're not seeing the fatalities that we were before because so many people are being vaccinated. And the next slide shows the vaccination update. Over 725 vaccines have been administered with partners across our state. You're going to hear from Dr. Tam and BB's efforts in the lower part of our state. We have over 281,000 Delawareans that have been fully vaccinated. That's over 35% or thereabouts of the eligible population. 87% of Delawareans 65 and over have received at least one shot. And I think it's about 75% that are fully vaccinated. And of course, those are the populations most vulnerable, the ones that we want to protect, our grandmothers, grandfathers, moms and dads, and some of us as well. 51% of Delawareans over 16. So more than half of Delawareans over 16 have received at least one dose. That's going to be our major focus in the weeks ahead. We need to get everybody vaccinated, or as a larger proportion as possible. This graph gives a really good illustration of the trajectory of the virus in our state going back to our first cases March 11th of last year. The run up in hospitalizations. This is the hospitalizations, which is a little bit of a lagging indicator for positive cases, but you can see the run up in the spring from early April till April 17th, where we peaked out at 337. And then through spring, early summer, and the summer months, our trajectory went downward and to a low in August, middle of August of 29. That's the middle of the graph there. And then we saw the uptick in cases and hospitalizations once again as we got into Halloween, Thanksgiving, the December holidays. We peaked there with hospitalizations, and on January the 12th, we went from 107 in November to 474, which is the peak over the last year of hospitalizations. And then the rundown that we've seen recently to a low of 99 on March the 9th. And then the recent uptick you can see at the far right of the graph where we've gone up to 149 again. Now starting to flatten out. Now that people are getting vaccinated, continuing to wear your masks when you're indoors in particular, we're going to see that decline as well. The next two graph really illustrates the effect, positive effect, tremendously positive effect of vaccinations on our senior population. The first graph is the weekly rate of new positive cases by age group compared to with the persons of 65 and over and those younger than 65. And you can see the yellow graph is those who have been 65 and over who've been vaccinated. And you can see that red line flattens out in terms of new cases. And the blue line, which is those under 65, you see the peak that we've just been through. So if ever there was an argument for making sure that you get vaccinated, this is the graph that tells the story, because it shows us that the senior population that's been vaccinated have a flattening out of those cases where all the other cases and hospitalizations were rising in our state. And here we go again with the number of deaths. And you can see as we vaccinated that senior population, this is for people 65 and older, this whole graph, those number of deaths have declined as we expected with the vaccinations to have that effect. So that's really good news. And it says to all of us that we really got to lean into making sure that the rest of Delawareans get vaccinated like our 65 and older have done, with 85% at least one dose and 75% fully vaccinated. You can see the impact, the difference on new positive cases, and the difference with respect to the deaths. It's just made a huge difference. So we also have with us today Dr. Carol Rattay, as we normally do. Dr. Rattay, thank you for joining us.
Thank you so much, Governor, and thanks for, it really is exciting to hear the great news of the benefits of the vaccine that we are clearly already seeing among our senior population in the state. So for those who are new to watching our weekly update, I often start with talking about areas of concern. Looking at the zip codes where we're seeing more cases is important, in addition to looking at the case rates and the positivity rates and the hospitalizations in our state to give us a sense really of what the virus level is in our state. What is exciting is that all of those indicators are down some since last week. And though, as we've been saying, we have been concerned that in April, we've seen higher levels in all those categories in comparison to March. Not to say that we can, throw caution to the wind, but it's great to have some good news on these indicators. As it relates to our areas of concerns, last week we had 26 zip codes that surpassed the criteria and were areas of concerns. This week it's down to 18. So that is good news. And among half of those 18 zip codes, the case rate has decreased. So again, good news. Now there are some zip codes that have had an increase in zip codes in case rates in the last week. In Wilmington, that's 19801 and 19802. Also Bear, as well as Houston, Clayton, Greenwood, Frankfort, and Del Mar. So, we'll keep an eye on those as we're seeing a little bit of an increase in those areas. But again, overall good news. I want to also touch on the variants that we're seeing. What is still on the rise is the percentage of samples that we are testing that are found to be positive for one of the variant strains that we're keeping an eye on. Now, the dominant strains that we're finding in Delaware through our surveillance testing program includes the UK variant and the New York variant. And as we have said, we're focusing on the percentage of the samples that we're sequencing each week that turn out to be variants. And the most recent week, it was 66% of those variants, of those samples that we tested compared to 52 the week before. So for those who have been following, it was several weeks ago that it was in the teens, and it has been climbing up since then, which is really what has been seen nationally. This UK strain has become the predominant strain of COVID that we are seeing in our state. And why we care about that is because these variants do spread more easily. The increased percentage of variants that we see in our testing really helps to explain why we still are seeing a relatively high case level, even as vaccinations increase and many people are being cautious. So one more point I'll make is that of the two strains that we are seeing, the vaccines are very effective against these strains. So that's the great news and really reinforces, leaning into the vaccine, as the governor just said. Let me shift gears a little bit to something else on the positive side. First, I just really want to congratulate all Delawareans who have stepped up and been vaccinated. They're protecting themselves, their families, their friends, and their communities. And they're really, you who all are getting vaccinated are helping us turn the corner of this pandemic. And you deserve to be rewarded for that. We hope you're finding lots of rewards. One of them, we think, is the new CDC guidance that was released yesterday. We are really excited about this new guidance. We've been waiting for this based on CDC's review of the science related to mask wearing in outdoor settings. And what CDC is saying for those who are vaccinated in many outdoor settings where we know it's safer, like parks and restaurants, small gatherings, vaccinated people no longer have to wear a mask when outdoors. That being said, I always have to throw a little bit of caution in there, right? There are some things we want people to pay attention to, which is there are some settings in which all individuals, whether they're vaccinated or not, still are going to need to be wearing masks. And again, this guidance really pertains to those who have been fully vaccinated. So if you have not, this new guidance does not pertain to you yet. So what it really states is that those who've been vaccinated can more safely go without a mask in most outdoor situations, including small groups of people who are both vaccinated and unvaccinated. But when we say almost all settings, what we mean by that is for larger settings, more crowded outdoor gatherings like community events, parades, sporting events, you're still going to see a recommendation and a requirement that all people wear masks, whether they're vaccinated or not, in these settings. One upcoming event is the NASCAR races at Dover Speedway. That will certainly be an event where we expect all people to be masked at all times, even though it's outdoors, even if they are vaccinated. So again, we know that this guidance could be a little confusing as to when you have to wear masks and when you don't, but just keep in mind, if you're in a crowded setting, then for some time, we don't know when, but at this point in time, masks will be required. And again, just to reiterate, the other nuance of this is if you've not been vaccinated, it is still recommended that you wear a mask even outdoors for small outdoor gatherings, when dining at a restaurant with outdoor seating, when you're not eating and drinking, as well as at large events. So this new guidance, again, is part of our evolving understanding and the growing science of COVID transmission. And while we know that this is welcome news for our vaccinated Delawareans, again, you will see events where the expectation or requirement is that all people will have a mask on. Let's talk about vaccination openings. That more good news is that it has become easier than ever to become vaccinated. And as we've reached the remarkable vaccination levels that the governor mentioned, we now have a number of state-run vaccination opportunities that have been offered to everyone on the waiting list. And we're also offering publicly these state-run vaccination opportunities, regardless of whether you're on the waiting list or not. Curative continues to vaccinate at Deltec campuses in Wilmington, Dover, and Georgetown each week. The Wilmington appointments are still filling quickly, and they are full for this week, but there are still openings for Dover and Georgetown for the rest of this week. This weekend, we are resuming administration of Johnson & Johnson vaccine following the safety pause by CDC and FDA that has now been lifted. We hope that pause gives everyone confidence that the safety system worked. The issue which triggered the pause, thrombocytopenia syndrome, we also call it TTS, really is very rare. It occurred in fewer than 20 women out of more than 7 million administrations. During the pause, the medical community has been educated on how to identify this and how to manage it. The public now is more aware, but those scientists who took a hard look at the science around this and the events that have occurred believe strongly that the vaccine's known and potential benefits outweigh its risks, and we agree. And this is why we are really excited that we have resumed offering Johnson & Johnson. Pharmacists in the state who have Johnson & Johnson have begun or resumed administering it, and we are offering Johnson & Johnson at the Dover International Speedway on Saturday and the Chase Center upstate on Sunday with open signups that do not require being on the waiting list. I also want to mention that if you haven't checked with your pharmacy or your medical provider lately, you should do so. Pharmacies and hospitals are seeing appointment opportunities go unfilled and are publicly taking appointments. So you may be able to get an appointment right in your neighborhood, even if you couldn't a few weeks ago. So that's also good news. We are also excited about a new webpage that we just launched today. We think this is going to make it so much easier. Where can I get my vaccine is on our new webpage that has links to the curative sign-up sites, to all of our weekend vaccination events in Wilmington and Dover, as well as to hospital scheduling pages and to the pharmacy scheduling system. So I recommend it to anybody looking for vaccination to very easily find opportunities near you. Let me shift now a little bit to some of what we're doing in public health. At our public health clinics, which are located in some of our state service centers, we have been vaccinating for the last several months, largely focused on underserved communities. Starting this week, in order to make it easier for people to get vaccinated, especially in communities that are a focus of our efforts of equity, 5 of our public health clinics are now accepting walk-in appointments. So you don't need to schedule an appointment ahead of time. If you're in the vicinity of the Porter State Service Center in Wilmington, the Williams State Service Center in Dover, the Riverwalk State Service Center in Milford, the Adams State Service Center in Georgetown, as well as the Shipley State Service Center in Seaford, you can just stop by and get a Pfizer vaccination, which is where we have available in our clinics. So again, if you go to our new webpage on where I can get my vaccine, you'll find the hours and the information about these sites. as well. We're really excited about really doing anything we can to drop the barrier of making an appointment, and again, just making it easier for people to be protected with a COVID vaccine. In addition to all these opportunities, we've been working with community partners throughout the state. We have 20 events around the state this week with churches and community centers and other sites, and we continue to work on reaching out to people for whom getting the vaccine too is just a little bit tougher. DPH is one of many organizations, including hospitals, community organizations, federally qualified health centers, employers, the VA, and others that are holding events every day to get vaccines into every corner and community of our state. And I'm so happy Dr. Tam is with us today. Dr. Tam and BB have just been such incredible partners throughout this pandemic, and they're doing a lot of great work to increase access to the vaccination, working with partners, really thinking out of the box in the community. So we're just so grateful to the work that is being done by BB and our other many other great partners across the state. And finally, since AJ Shaw isn't with us today, I'm going to pretend that I'm him, and got to continue to emphasize the important message of testing. We as a state continue to do well with testing. AJ and his team have ensured that there's lots of testing access, but we have seen testing decrease slightly, and we just have to remind people that this continues to be so important for limiting the spread of infection, to warn people that they may have been in close contact with, so that they can quarantine and also get tested. Again, these are just the testing continues to be an important tool in our toolbox, especially when we continue to see higher levels of the virus than we would like to see in our community. So with that, I'm going to hand it back to the governor.
Thank you very much, Dr. Rattay. And we're going to go right to Dr. Tam, the aforementioned Dr. Tam, who's the president and CEO of BB Healthcare. And thank him for his partnership, and in particular for helping us get vaccines in the arms of Sussex County and visitors to Sussex County. Dr. Tam.
Thank you, Governor Carney. I'm so grateful to be here with you and Dr. Rattay and Dr. Bunting and the rest of the leadership team in Delaware. So I am David Tam. I'm the president and CEO of BB Healthcare. I've been here about a year, as the governor knows. The first time we actually were introduced was when I was driving across the country in my U-Haul. And here I am 1 year later, being part of this opportunity to share with you what's going on. The next slide will show you really that what we've been doing here at BB Healthcare here in Sussex County as the community's health system for Sussex County is that we have been delivering vaccines. We've delivered 35,000 vaccines by BB Healthcare in partnership, of course, with other agencies like the Department of Public Health, with what AJ Shaw and Dr. Rattay are doing, the pharmacies, and of course, our other clinics, our other private practices all throughout the state. Where we have done a lot of work is working with our partners, like the First State Community Action Agency, La Esperanza, the Red, the Nanacoke Indian Tribe. We've worked with the poultry industry, as well as with the restaurants and the restaurant industry, and many, many more partners to really get to places where we need to provide opportunities, reduce the barriers to access for getting people both tested as well as vaccinated. And that's an important thing for us because, as you know, here in Sussex County, it is a very diverse population separated by large distances. And so it's really important for us to reach out to our partners. Next slide, please. One of the things that we've done recently as we continue on our quest to get as many people vaccinated, as many vaccines into people's arms, is we've partnered with the Sussex County library system. So they have a bookmobile that has been sitting unused because of the pandemic. We partnered with them and, of course, our Sussex County Emergency Management, Emergency Medical Services to really provide a mobile platform for delivering vaccines. So we take the van, we take the bus, we go out to different places where we know that there are barriers to access, places where homeless people congregate, where people go to get services and they trust those places. And that's an opportunity for us to vaccinate people who otherwise might not feel comfortable coming to a clinic or to a hospital or to another facility. And so we've been very lucky in having that. Of course, going out and vaccinating and building partnerships. The other thing that we've learned, it's kind of interesting to use the bookmobile because it gives us an opportunity to educate people and to provide a learning environment about COVID-19. I'm sure that's something that Dr. Bunting will talk about later, about the importance of educating everybody in terms of what COVID-19 is all about. Next slide, please. I want you to know that we continue to do this across the entire Sussex County. So like Dr. Rattay, like the state, we also have a two-pronged approach, actually a three-pronged approach to making sure that as many people as possible understand how to get the vaccine and then have the opportunity to get it. First, we have it online. You can go to bbhealthcare.org /COVID-19-vaccine. And it is an online system that allows you to make an appointment at one of our 4 sites across the county. And so without having to go on a phone and talk to somebody, you can go ahead and make an appointment to get a vaccination. And then there is a process by which we email you back and let you know when your appointment is. And we have a high success rate of making sure that you get your second vaccine if you are taking a vaccine like Pfizer or the other vaccines that require 2 doses. And we will start working with the state on the Johnson & Johnson vaccine as well. You can also call the BB COVID line at 302-645-3200. It's an opportunity in multiple languages to ask questions about both testing as well as vaccination, and then make an appointment. And the third way that we are working with this is to once again work with our community partners like LARED, La Esperanza, the Nanaco Tribe, First State Community Action Agency, and others, churches, to make sure that people get a voucher or an opportunity to get an appointment through that agency and then coordinate with us at BB Healthcare so that they can come in and get that vaccine into their arms. Next slide, please. I want to make sure and take an opportunity as I am able to have the privilege to speak on behalf of all of healthcare here in Sussex, here in Delaware. And that is to say that, on behalf of all the health systems, I know that we are all working hard to ensure that we get through this in our different communities and our different neighborhoods. Please remember, though, that as we continue to go through this phase, as we continue to monitor the COVID-19 pandemic, as we continue to focus on testing and vaccination, don't forget to come in and get health care that you need. You may have heard that people have not come in to see their doctors to get the care that they need, to refill prescriptions, to come into the emergency rooms when they're concerned about strokes or heart attacks or things like that. And now is the time. It's safe, it's effective. Come in and get seen with the care that you need so that you can avoid some of the other medical issues that can result if you don't take care of yourself. Here at BB Healthcare, we've opened up another emergency room and a cancer center in Millville. We've also been working on our specialty surgical hospital in the Rehoboth campus. And that's going to be on time, on budget here in the summer of 2022. And we've taken the opportunity during this COVID period to recruit more than 55 physicians and providers to the Sussex County area, both primary care and specialty care, because we know that we will face people who have the challenges of needing health care once we get to a point where we're more able to walk around and go to facilities and do all the things that we want to do. Next slide, please. I think that's all the slides I have, but I do want to take 1 minute then. Like I said, it's been my first year here. I just want to take the opportunity to thank both the governor as well as the state for welcoming me into Delaware. Certainly, it's nice to be here in beautiful Sussex County. As more and more people come down, we want to make sure that everybody gets vaccinated, that everybody continues to get tested, and that for now, continue to wash your hands, wear your mask, watch your distance anytime that you are concerned, because we want to have a great summer down here in Sussex County. And I think on that note, I'll turn it back to you, Governor Carney.
Thank you, Dr. Tam. You don't have to put out the invitation. People are coming to the beaches. I think it's going to be a big beach summer this year. We appreciate your partnership, and thank you for that last message to folks about not delaying their hospital and healthcare needs. We know that that's been an issue and a problem. Don't be fearful of going into to get needed procedures done, things that you put off that end up with a worse condition in the end. So make sure you take care of your healthcare needs as identified by your physicians. One of the most challenging things that we've had to do under COVID-19 is educate our children. Teachers and educators across our state have been doing an unbelievable job under the most difficult circumstances. Children are in either some version of in-person learning or remote learning, or a combination of the two, as we've moved through this pandemic over the last year, and doing their best to make sure that children get the instruction that they need. We know that there are gaps that are there, and we need to fill those gaps. Dr. Bunting and her team have come up with a great approach to help school districts, schools and teachers and all our educators and parents make sure that we get our children where they need to be. Dr. Bunting.
Thank you, Governor. We do admit that there has been a disruption to our learning year, and so our task as dedicated educators is to make sure that we're filling in for some of that lost learning time as we look at the summer and the opportunities that we might have. So my gratitude again goes out to all of those who have adjusted very quickly to a new way of instruction, and we're actually rethinking schooling at this point to make the best out of a situation and to make sure that we make it the best for our children. We're very dedicated to making sure we provide resources and opportunities for our children, not only in the academic realm, but also we are concerned this year about the physical and social and emotional impact that this experience with the pandemic has had on our students and our staff. So we are taking a look at how to better support and continue to support, since we are a support agency, our schools as they are supporting the students that they are concerned and work with on a daily basis, and address that unfinished learning that has been created by COVID-19. With that, we have devised a plan for filling in for some of those lost opportunities. And we have provided a menu of choices to our local education agencies, both our districts and our charters. It really has 4 core actions that are involved in what we're trying to do in our collective effort to prep our students for the following school year, the school year that will begin in September. At the heart of this plan is the adoption and the preparation of our teachers to use materials that we consider to be high quality instructional materials. And this isn't a personal opinion for any one of our teachers, but there is a list that comes out nationally in Education Week of high quality instructional materials that have been proven to create the greatest increases in proficiency and in learning. So we are going as a department to provide statewide licenses for all of our students in the state if districts choose to participate in this program for accessing those high quality instructional materials. For example, Zern Math would be provided for every rising 1st through 8th grader. And this is a well-respected program that has lessons for 12 weeks, for example, 30 minutes a day. Some of this could be done independently for some students, but we also will be training and preparing teachers to be coaches as they go through these experiences. And this could be done virtually. It could also be used in our classrooms because many of our local education agencies will be conducting in-person learning opportunities in schools for students as the summer goes on. So watch in your particular districts for the offerings that will be provided in person. We also would be strengthening our literacy preparation for the next year through a summer booster literacy program with some of the well-known and, again, results-driven programs such as bookworms here in the state of Delaware that have proven successful. And our literacy effort will be based on the science of reading, and we will be training teachers in the science of reading. So they really have revised and renewed skills. If it's been a while since they've had a reading course, we're going to be able to provide that for them. And our literacy efforts will be dealing with students from first grade, rising first grade through fifth graders. So this support and training and the professional learning is the second major part of our plan. And this would be for not only our educators, but our school leaders and any of the staff members that provide support. That will be initial training before their learning experiences begin, and it will continue. It will be ongoing. And this isn't something that we realize will be completed in the summer. We are planning also for continuation of these efforts into the fall months. And as we look at the investment of our stimulus monies, we are looking for that long-term support of our students and our staff as we try to fill in the gaps that might have occurred from this unprecedented learning experience with interrupted learning this year. We also recognize that to know exactly how our students are operating, at what level, and what their needs happen to be, that we need to be using data to drive our instructional efforts. So we will be finding a way to ascertain where our students happen to be operating and what learning needs they have based on where they were when they last left us, but where they are now, because we need to see where they are so that we can take them to the next level, remembering that all of these efforts are going to be invested in helping our children be ready for the school year in the fall. They will be looking mostly at grade materials. We know the extra support will be there, but we want them to be moving forward with their learning. So schools will be implementing a balanced assessment system, and they will be using that data to drive the creation of our lesson plans and the supports that we need for our students, providing scaffolding for our students as they move forward in grade level instruction. And so the final part, the fourth of our core actions, will be to support structures to accelerate learning. And some of this will be done, for example, through providing extra people to help. We will be hiring high dosage tutoring groups at times. We have community groups that are helping us. We also will be preparing our own teachers to do that high dosage tutoring for the students that districts and charters identify as those that are most in need of that extra boost. So the focus is going to be on helping all of our children. We have a very dedicated staff. They're looking at what they need to do to provide the extra learning opportunities that our students need at this point and deserve. So together, we will make that happen all through this summer and into next school year. Governor, I turn it back to you.
Thank you, Dr. Bunting. A really good plan to assist the school districts. There's lots of money that's being provided by the federal government to the individual school districts. We would encourage everyone with the children in the schools to pay attention and contact your local school board to know what's going on and how each district is going to respond. We've been talking to the superintendents. They're each working very hard to make sure that all their children get the learning and the instruction that they need over the summer and into next year and throughout next year. And they'll have resources provided by the federal government to do that. Department of Education, Dr. Bending and her team will provide the support that they need to carry through on their plans. And each of them will have a plan and have to have a plan submitted. But before we take any questions and answers, as we normally do in a press conference, we'll do that tonight with the town hall. We do have a public service announcement regarding Trauma Awareness Month, May 2021, in partnership with the Family Services Cabinet Council, which is our family services agencies working together to address social problems in our state. And the Trauma Matters Delaware will have a series of events throughout this month of May for organizations and individuals to learn more about trauma-informed approaches to the delivery of services. And so if you want to submit your organization's virtual events, you can go to Trauma Matters Delaware de.gov/Trauma Awareness Month. We look forward to you registering and hearing more from you with the events around trauma awareness during the month of May here in 2021. We've had a number of questions, I know, that were pre-submitted. You can submit additional questions in the chat box. And we have someone there, Haley or John, to present the questions to us.
Thank you, Governor. We're going to go right to a couple of the pre-submitted questions. We have a question from Jill here. There were two similar questions as well, and I think several people on the screen can answer them. How are you reaching out to underserved residents who may not have internet connections or even enough knowledge of English to follow the steps to sign up for a vaccine? Also, Jill asked, how are you reaching out to homebound populations in the vaccine?
Well, first of all, before I turn it over to Dr. Rattay and Dr. Tam, one of the reasons Dr. Tam is here is the partnership that he's provided with community organizations, his healthcare agency, Division of Public Health, and getting into hard to reach communities. Our goal from the beginning has been fast and fair, getting those vaccines out into Delawareans' arm as quickly as we can, as efficiently as we can, with access to all our respective communities, the diversity of our state, paying attention, being very intentional about that. And the hardest part is people that are hard to reach, people that aren't internet savvy, because so many of the ways of getting an appointment through your pharmacies or through the state to sign up are through the internet. And so we're taking those signups directly to people through Lisa Henry and her team at Public Health. Dr. Rattay, they've been doing an outstanding job. And in partnership with folks like Dr. Tam and the other hospitals in our state, we have been working with our pharmacies. They get a supply directly from the federal government. We've, as a state, have gone out and signed up people, knocked on doors, got people to register and to meet the diversity goals that we have. Dr. Rattay and Dr. Tam, you want to add to that?
Yeah, so thanks, Governor. It's such an important question, and it is so important to all of us fundamentally that we're reaching the people that may have barriers to getting vaccine. We have really been focused on using data to identify communities that are more vulnerable. We use something called the Social Vulnerability Index, which was defined by Centers for Disease Control and Prevention, and really been focusing in those communities with community leaders to identify really what is the best way to reach individuals in those communities. We know often it's, those community leaders are the trusted individuals in those communities. Church leaders have been incredible partners in really leading the way in themselves getting vaccinated, and also, working with us or other vaccine partners like Dr. Tam and, as some of our smaller pharmacies and others to bring vaccine to people. The example I used today of our now our public health clinics being walk-up clinics, we're really hopeful that communities will really embrace this idea, whether it's our clinics or others that are available, and really get the word out there that this is an easy way to get vaccinated. But we are always open to suggestions, and we really rely heavily on our community partners and community leaders to find creative ways to reach people.
Some thoughts, Dr. Tam?
Thank you, Governor. I think there are 3 or 4 ways that we at BB Healthcare work to do this as a community health system. Number 1, of course, people still go to the emergency room, people still come to the clinics, and every time someone checks in for anything, we always make sure and ask them if they want to get a COVID vaccine and if they want to get tested. That's, I think, a critical element because it's about healthcare. I think the second thing we do is, like Dr. Rattay said, we partner with our community leaders. They trust their church leaders. They trust their community leaders. You know, it's where we talk with Bernice Edwards at the First State Community Action Agency and their staff, or at the Nanacoke Tribe, where we go right to Chief Natosha Carmine, and we talk with them about how they can then speak to their people. And I think that's an important element. I think the third thing is we here at BB Healthcare have worked with employers because employers is another touch point for people. You know, it's not like we force people to take the vaccine, right? Because it is still a healthcare choice, but to give people at the restaurants, give people at the poultry industry, with the hotel industry, with the construction industry, the opportunity during a safety check to say, have you gotten your vaccine? Here's the way to do it. Let me make the appointment for you, are all ways that we have worked together as a community health system to get as many vaccines into people's arms.
And we've done thousands of vaccinations in church parking lots in conjunction with faith communities because, you know, people trust their faith leaders. They're plugged into their local place of worship, and we've used those venues and those contacts to get the vaccines out.
Thank you all. Here's another question specifically for Dr. Rattay from our pre-submitted comments. Dr. Rattay, Dave asked, could you clarify for the public the differences between the 3 vaccines, Pfizer, Moderna, Johnson & Johnson, and help ensure that the public knows as much about potential side effects? Are there differences in side effects among the vaccines? And could you just elaborate on that a bit?
Yeah, I mean, in general, all 3 have been through FDA, EUA approval. All 3 are very effective. All 3 are very effective in preventing death and hospitalization and transmission of this infection. So, I mean, it's pretty amazing that we're at this place in the pandemic where we've got 3 great vaccines that are available to the public. The Pfizer and Moderna are very similar vaccines. They're called mRNA vaccines. They're very effective, well tolerated. They're both 2-dose vaccines. And with both those vaccines, as well as the Johnson & Johnson, it's not uncommon to see some side effects. The most common side effect by far is soreness at the arm where the site of the injection took place. Some people get very tired. Some people get headache. Some people get a fever. You can't get COVID from the vaccine, but some people just don't feel great the 24 hours after the vaccine. And we are seeing that that's a little bit more so for the second dose of that vaccine. I just think it's important for people to recognize with the second dose, they might feel a little bit more under the weather, and that's okay. It will pass, and it's so worth it. With the Johnson & Johnson, as I mentioned, this very rare disorder that's been found, the syndrome that's been found that's causing blood clots, it is likely to be attributed to this Johnson & Johnson vaccine, but again, it is extremely rare. Now we know how to look out for it and how to treat it, and also, you know, just really recognizing it's so very uncommon. We feel good about it, but those are the most common side effects. I'd love to hear from Dr. Tam what you're seeing and what you're experiencing among your patients. So
here, where we see a lot of patients, and there are people who have, especially after the second dose of either Pfizer or Moderna, some of these symptoms, consistent with a mild response. I don't even want to call it a reaction because it's not an allergy to anything. And, at the end of the day, I don't want to make light of it, but I say to patients and people, listen, what you're now feeling is your body reacting appropriately to the vaccine. Your body is making an immune response. And isn't it great that you have a physical manifestation of the effectiveness of the vaccine? Because if this is how you would feel with just the vaccine, imagine if you had COVID-19, the infection. And I think that kind of gets people into the right frame, as this is all good. It's not comfortable, but it is the price we pay to make sure that we get to herd immunity and take care of our families. And actually, Governor, if I may just take one thing, I think the other thing is, speaking of boots on the ground, it is still out there. I was going to say COVID-19 is still out there. We are seeing, as the governor showed, lots of reduction in the numbers of people who are hospitalized, as well as the number of people who are who die from COVID-19. That's reduced, but it still happens. It's happening in younger people now. And so once again, it just is a reminder that it is still out there. And even though the numbers are good, if you're the one that gets COVID-19, or if your family member is the one that gets COVID-19, it is still a devastating problem.
And that's a really good point. And it goes to, I know, a lot of the questions that were pre-submitted. You know, we're doing really well, and we've got half of our population with at least one dose. But we still got the other half that's not vaccinated. And the virus, we know, can be present and spread even with somebody that's vaccinated. It's just protected against serious illness, death, hospitalization, as Dr. Rattay said. So we need to still focus on following the mitigation strategies. Wear a mask when you're indoors in particular. When you're outdoors, as Dr. Rattay said, new guidance there. But be careful, because people aren't vaccinated and they're still exposed. And get vaccinated. It's well worth the aftermath of getting that second dose, where you feel a little bit like you got a touch of the flu coming on, which is what I felt like, but it was well worth it. So 24 hours it was done, boom, and you feel great.
Thank you, Governor. And just one more question, general vaccine question that we're going to take, and then we have a couple questions about schools and economic restrictions. This one's from Peggy. How long does the efficacy of the Pfizer or Moderna vaccine last? Will there be a booster or another 2-dose vaccine needed? What do we know about that, Dr. Rattay?
I'm going to hand that over to Dr. Rattay and Dr. Tam. That's out of my league.
Well, these are great questions, and we're all learning from the science as we evolve in the journey of this pandemic. What we know at this point is these vaccines, the Pfizer and Moderna, have been the studied for the longest. Their protection is certainly lasting at least a good 3 to 4 months. But since they're pretty new out there, we don't have more time that we've been able to study those. So we just don't know yet for how long these vaccines are going to protect us well, and whether a booster shot will be necessary. But with other respiratory viruses like influenza, which behaves similar in many ways, booster shots are necessary, and especially because we are seeing these variants, these genetic mutations. And so we think it's likely that an annual booster shot is going to be necessary for this. And, it's good to expect that. We don't know for sure, but that's likely. I don't know if Dr. Tam, you've got any additional intel on this.
I would leave the public health and the science to you, Dr. Rattay, because you've done such a great job with it so far. But there is uncertainty in the literature about what will happen, even, of course, when you look at Europe and some of the stuff that they're doing. Here's, though, the certainty that I have, and that is that we now know how to do this. So if a booster shot is required, and the science says it, all of us here in Delaware, the health systems, the clinics, all of us know now how to get it done. And I think that is the certainty that people should have coming out of this, to know that we know how to do that booster shot.
And to Dr. Tam's point, we will prepare for an ongoing apparatus to provide that if need be, just like we do with the flu shot. And it'll be more like that system that's based primarily on primary care, healthcare systems, and pharmacies. But we are thinking through the possibility that we'll need those kinds of networks and that framework.
Thank you, Governor. And we'll turn to a couple questions on schools. We've gotten several questions from Tim Eck in the comments, and also from Jennifer and Jen in the pre-submitted questions. Essentially boils down to this question from Jennifer: when will our students be back in school full-time, 5 days a week?
Yeah, I keep saying this. The goal has got to be at the beginning of the school year next year. Full-time, everybody back. Make sure we've got, by then we'll have an opportunity, we'll have had an opportunity to get the students who are eligible to be vaccinated. Right now it's just 16 and up. We expect that one of the vaccines will be approved for the younger children. But we've got to be ready. We can't afford to go through another year with the mix of learning, notwithstanding how the effort that went into it, the great work that so many people did. We just have to, it's just not enough to have this remote learning when you need, particularly the younger children, children with disabilities and learning problems and challenges, they need to be with in-person instruction. And so that's the goal. Whether we'll be able to reach it will depend really on the trajectory of the virus and the spread of it, the effectiveness of vaccinations, and our ability to address some of those issues. Thoughts, Dr. Bunting and Dr. Rattay?
Governor, I would echo that goal. We would love to see all of our students back in for a regular school year that has fewer disruptions. We're preparing them for that, and we're very hopeful that that will be able to be a reality.
And I'll just add, and some people don't know this, both Dr. Tam and I are pediatricians, and we care deeply about getting kids back to school. We know from many perspectives how important this is. We also recognize, and we hear this a lot from folks out there in the public, the concern about school buses. Right now, we have a 3-foot distance that is in place for kids in school buses. We know that that's a barrier, and we know that we need to figure that out before next school year. But we are all on the same page. We want to get all kids back in-person learning by the fall.
I mean, we simply owe it to our children and their families. I mean, their futures depend upon it. They need the robust instruction that in-person instruction provides. Now, it needs to be done safely. We all know that, and we're committed to that. And I know the school districts and leadership and teachers are as well.
Thank you, Governor. And Dr. Rattay, here's another one we got a few times. This is from Claire on Instagram. Claire asks, when will indoor capacity at restaurants and generally for indoor events be increased?
Yeah, my hope would be sooner rather than later. It depends, again, on the data that we started this presentation with, the number of positive cases, the trajectory there. We need to see improvement, our success in getting Delawareans vaccinated. But let's be clear, indoor environments there's just a greater risk of transmission. We know that. So we need to figure ways. We're getting now to the warmer weather. Restaurants have last year took great advantage of outdoor dining and outdoor spaces. And I know not every restaurant has that capability, but that'll help us. That'll give us time to get better. But the motivation that we all should have to get vaccinated and to follow the rules, mitigation rules, is to be able to get back into our favorite restaurants, to enable them to have greater capacity. And that's our goal, and the sooner we get there, the better, from my perspective.
Thank you, Governor. And we'll have a couple questions left here. This is from Julie Wilhelm. A lot of commenters on Facebook and on live stream have asked about gyms and exercise facilities. Julie asks, why are we allowing unvaccinated children to play sports maskless, but vaccinated adults have to wear a mask in the gym? Governor, Dr. Rattay, Dr. Tam, can anybody address that?
Let me just make one comment. Sports was a big part of my life, and so it's been a very important part of our conversations, as you can imagine, through this whole pandemic. I work out at the YMCA. I know it's way, way riskier than working out outside. I know some sports, I've played lots of sports myself. I know some are riskier than others, and we've approached it in a smart way, figuring out where risk is and where risk isn't. And Dr. Rattay, you can take it from there.
Yeah, I mean, you really, I think framed that great, Governor. Gyms, and I love gyms and athletics, physical activity as well. But in our state, across the nation and across the world, there has been a lot of super spreading in gyms. there's a lot of exertion, which leads to, vesicles of virus coming out. And I know that a lot of people haven't loved wearing masks in gyms, but we haven't seen any significant clusters in gyms. I look at our cluster reports every single day. And since we started wearing masks in gyms, we're not seeing those outbreaks. Before, we saw a number of them. And so gyms are unfortunately one of the riskier places because they are indoors because of the exertion. And we did just make a change. Now people can be 6 feet apart in gyms. As Governor says, we lean into vaccine. The more and more we lean into vaccine, the more and more we're going to be able to make these changes. Outdoor sports, and I've got kids that play sports. I know Dr. Tam as well, is very engaged in this. The outdoors, the interaction between these kids with medium risk sports, it's just very, very limited. And so although on the sidelines they cluster, certainly, in buses, other settings, there's risk, but when they're on the field playing, there just is minimal to no risk for these medium risk sports. And that's why we felt confident with making that change.
Thank you, Dr. Rattay. And this is going to be our last question of the night, and then I'll turn it over to the governor for closing remarks. We had just a general question from Ray, from Bear, in the pre-submitted questions, who asked about these elevated case levels, and with all the prevention methods and vaccinations, what are people doing wrong to contract COVID, and what could they be doing to lower the case level in Delaware?
Well, one of the things that we know we've learned over the last year is the most important thing that you can do is wear a mask, particularly when you're indoors. Keep social distancing. Now you've been vaccinated, outdoors, it's not a large gathering. You can go outdoors without a mask. CDC, the latest from the CDC. So we got to focus on making sure everybody gets vaccinated. That's job number one. Job number two is when you're inside, when you're at, in close quarters, you need to wear a mask. I mean, it kind of, in some ways, boils down to that. I don't know about Dr. Rattay. It's pretty simple at this juncture. Get vaccinated, get vaccinated, get vaccinated. Still get tested when you travel, in particular, when you come back, you have people coming in. We need to have that surveillance out there so we know what the spread looks like. And then wear your mask, particularly when you're indoors. Follow that instruction.
Governor Carney, if I could just jump in on that, I'm sure Dr. Rattay has much more better data on this, but the fact of the matter is, because we watched our distances, we wore our masks, and we washed our hands. Dr. Rattay, isn't it true that the flu rate was significantly lower than in other years, right? And I think that's just an indication of, one, how effective those strategies were to prevent something like the flu. Also a respiratory, like Carol said, we're both pediatricians, so the stuff that comes out your nose and how more infectious that COVID is, that despite doing all that, we still had peaks. And I think that's just an indication of why it's so important to continue doing those 3 Ws.
Yeah, exactly. The science so supportive, mask wearing and distancing and being outdoors as much as possible. And vaccination. And
vaccinations. And if you look at the chart that we had up earlier, and we're getting it up again, you can see the population that got vaccinated. Right there, you can see the red line, that's 65 and older. The yellow graph, there it is again, 65 and older on fatalities. As we vaccinated that population, the fatalities dropped off almost to nothing. If you look at positive cases, if you could put that one back up, this is the best evidence, the best reason for getting the strongest argument for getting vaccinated. You can see the red line, that's people 65 and older. They're getting vaccinated. The number of positive cases, dead flat. 65 and under, they're not vaccinated. You can see the number of positive cases with that most recent surge. That's as good evidence, as good an argument as we can present to everybody for getting vaccinated. Again, I want to thank those on the screen, Dr. Rattay and Dr. Bunting, for their work here in state government with public health and with education. Two incredibly important areas for the people of our state, our children, our families, and the health of our state. And Dr. Tam, thank you for coming to Delaware all the way from California to provide the leadership that you are at BB Healthcare in the lower part of our state. We appreciate your partnership. Again, thanks to Pam for being with us with your sign language for the deaf and hard of hearing. And thank you all again for joining in. We look forward to seeing you next week.